Hi guys, I am Dr. Elizabeth Yurth. I am the co-founder and chief medical officer of Boulder Longevity Institute in Boulder, Colorado. And I'm here with Heather Harvard from Genova Diagnostics. And honored to be here, Heather, because I love Genova. I love some of the labs you do. So why don't you tell us a little bit, first of all, just introduce yourself, tell us who you are, what you do with the company,
Yes.
and then just let me know, what do you see advanced labs, how do you see those fitting into most longevity practices? I mean, where do we actually pull in Genova over all the other basic things we're doing?
Thank you. It's nice to be here. Again, I'm Heather Harvard. I'm with Genova Diagnostics in strategic accounts, and I cover the state of Florida. So where do we see advanced labs fitting in? They are foundational to modern longevity practice because longevity medicine is inherent, data-driven, and personalized. If the goal is to extend health span, not just lifespan, you need to dive deeper into biological insight than standard screening labs typically what they provide. So advanced testing allows clinicians to detect dysfunction before disease develops, quantify biologic resilience such as gut integrity, detox capacity, and metabolic flexibility. Also identify root cause of inflammation and oxidative stress. Also tracks progress objectively over time. So in longevity medicine, you're not just managing disease, you're optimizing systems. Advanced labs provide that clarity and measurable biomarkers necessary to move towards more reactive care to proactive, precision-based intervention.
That's so valuable and important because I know as a longevity physician, I've been doing this for 20 years. You know, we often say in this medicine we don't know what we can't measure, and I think there's a lot you can do as a physician just by listening to patients and getting a gestalt. But at some point, it comes down to having to look for more data. And I presented a case just a little bit ago of a client who had horrible recurrent GI problems and really had been not diagnosed by her physician over and over and over again. So I ran your GI effects test,
Nice.
and it, right there gave me, this is what's going on. There's cell membrane breakdown. She has a pseudomonas infection. There's disruption of the epithelial barrier. So it was a key player in figuring out her disease, which honestly had been years and years and years of no treatments.
Wow.
So I think it's so important what you're saying about longevity physicians have to have the ability to take the next step, to deep dive things. When you look at Genova as a lab, how do you think you're different from all those other labs out there?
So, Genova Diagnostics, it's a specialty clinical laboratory focused on functional and integrative testing. For over 4 decades, we've developed comprehensive panels that assess physiological functions across key systems, including gastrointestinal health, metabolism, nutrition, hormones, and detoxification. So, some of these things that differentiate Genova is the functional depth, clinical interpretation, research-backed methodologies, education, and partnership. So our goal is to translate complex biochemistry into actionable insight that clinicians can use confidently in patient care.
That is one of the things about your company that I do love is
Thank
the
you.
education focus. So as a physician, if you haven't run some of these tests, you guys have great sites to go through that honestly and videos to watch and just be able to walk things through, right? So it's not that you're just hanging there. If you've never ordered a test before, you're just hanging there with
True.
no idea. So I love that you guys have really brought that education. These great, for those guys who haven't used it, you really get some very in-depth, of every marker that you're looking at, so you don't feel like you're just, oh my God, I got this test with all this information, what do I do now? What do you find when you look at categories of testing? Do longevity physicians tend to use to really build up their most foundational work?
So clinicians often build a standardized core workup around several key areas, such as gastrointestinal health, so microbiome balance, inflammation, digestion, gut barrier integrity, as well as metabolic and mitochondrial function, such as organic acids, oxidative stress, energy production, detoxification capacity, within nutrition status, micronutrient sufficiency at the cellular level, hormonal balance, sex hormones, adrenal markers, and circadian rhythm patterns. And then lastly, cardiometabolic risk and inflammation, so advanced lipid markers and inflammatory biomarkers. So these consistently evaluate these systems. Clinicians can establish a baseline, stratify risk, personalize interventions, and track improvements over the long term of a person's or a patient's health journey.
I think if people aren't sometimes doing this type of medicine, they go, well, that sounds like a whole lot. I will tell you, as you start to get deeper in this, and I don't think everybody should run to all these tests, right? But for instance, I am a big fan of mitochondrial function. I think mitochondrial function is at the root of every disease. And yet there's not a lot that I can look at in a basic lab panel that's going to tell me about mitochondrial function. You can actually utilize your organic acid test to kind of really discern what's going on in these metabolic pathways, figure out where the disturbance is, and that's going to gear me to how to treat it. There's really not another way to do that, really, where I can say, oh, this is where this pathway is disrupted that's affecting the mitochondrial function, which is why you have no energy. I mean, what am I going to look at in my typical CBC and CMP that's going to tell me that this is really not there? So I think these are really valuable, particularly when you're trying to take the next step. And again, even some very basic things on there, if you understand some very basics, it can go a long way to help you with diagnosing your patients. One of the tests I'm probably the biggest fan of for you guys is your GI effects test. I love the way it's laid out. I love the way the first page, it's kind of like, okay, here's the information. You've got these little circles, guys, where, it's like, okay, a 0 to a 10. A 10 being, this is bad. A 0 being, hey, everything looks great here. So you can really, first glance, just look at it and go, oh, this person is really got something wrong with their microbiome. Oh, this person's really inflamed.
Yes.
And then you can go to the next steps and deep dive it. So I think it might be one of the most valuable tests for me. And it's simple to utilize to explain to a patient too. They've got great pictures, so really easy to explain to a patient what's going on when you have that test. So when you look at the GI effects test, why do you think longevity physicians should utilize that? I mean, why is gut health so important?
I love that you shared that. That's such good feedback about the GI effects, so thank you. So it's a comprehensive stool analysis that evaluates the gut microbiome, digestive function, inflammation, and markers of gut integrity. It provides insight to the microbial diversity and balance, pathogens and opportunistic organisms, short-chain fatty acid production, digestive enzyme activity, inflammatory markers, and intestinal permeability indicators. So longevity clinicians care deeply about GI health because the gut is central to systemic inflammation, immune regulation, metabolic health, and even cognitive function. So, and all of what you just said too.
Right.
So the microbiome influences things like nutrient absorption, mitochondrial efficiency, cardiometabolic risk, and aging pathways. So if you want to improve resilience and reduce chronic inflammatory burden, optimizing gut is often the first high leverage intervention.
Completely agree with that. In fact, we always sort of tell our physicians in our practice, okay, get all your baseline labs. The next test you're going to go to is going to be looking at the gut, because the gut is going to often be the missing piece. When you can't figure something out, because it so affects the neural system, it affects the cardiovascular system, it affects your immune health. And so when you look at some labs, you're like, gosh, I'm not sure why your inflammatory markers are high. I'm not sure why your immune markers are showing dysfunction. There's not an answer there. We always say, hey, there's a billion tests you can choose. Next step, go to the gut, right?
Right.
And that's going to oftentimes give you your answer right there. Most people are going to find something there, fix the gut, and then move on to some of the other more sophisticated tests. But start with the gut. To me, this becomes almost, we often say, should we just get that in our baseline lab panel, right? Should everybody get a gut test? Because I can tell you, even if you think you have a good gut, I thought I had a good gut until I did a gut test. And I was like, well, my gut's not so good. So almost everybody has some work they can do on their gut. And unless we fix it, we're sort of treading water trying to get them better. I do think sometimes your tests, you can look at them and be a little bit overwhelmed by the amount of data. And as we talked about before, I do love that you guys do have a lot of information online. But what else are you doing to kind of support your physicians, beyond just giving them results and maybe giving them, sort of a stuff they can look at online?
Right, and that's a great question to address anyone who gets overwhelmed with a GI effects, because it does give so much information. So we believe that delivering a result is only the beginning. So Genova supports clinicians through clinical education programs, webinars, on-demand courses, and live events. Also case-based learning resources, access to clinical consult services for case discussion, interpretive guides and research summaries, and then also dedicated account support sales representatives. Our goal is to empower clinicians to feel confident about interpreting complex data and integrating it into real-world patient care. And then longevity medicine success depends on translating advanced diagnostics into strategic intervention. We see ourselves as a long-term partner in that process.
I've been doing this a long time. I've been doing it for 20 years. So I haven't really utilized some of your, like online consultations, but I do remember early on in my career where being able to just honestly get on the phone with somebody and run a case by them and say, this is what I'm seeing, I don't understand it. It's huge, right? That you can
Right.
actually get a person on the phone who could actually walk through this data with you.
Yes.
And not everybody does that. Yeah, sometimes you can read something, you can watch a video, and it still doesn't make sense. You say, this doesn't make sense to me. People get on with somebody. So I think that is so critically important, and I think your guys' customer support has been incredible in that realm. You are there. I also think from the perspective of both myself and the patients, there are some, when you look at like a lot of the GI testing out there, there's some pretty sort of complicated ones in terms of collections and things like that.
Right.
And so I do think you guys have made that relatively simple as well, which is nice. It's never a fun test to collect your stool, but you've made it relatively simple for the patients to do. And we also get really prompt results, which is also, I think, really important. Sometimes you'll wait, 6 weeks for a result. And you guys are really efficient at doing that. So Heather, thank you so much. I really appreciate you talking to me about Genova.
Yes, thank you.
I appreciate you spreading this information to people. I hope that people look into all the labs you guys have, because I think you have a lot. And I do hope that people remember that, focus on that gut first and then take the rest of your labs from there.
Exactly.
But I appreciate it. Anything else you want to add?
Yeah, no, thank you so very much for your support. Love all that feedback, and thank you for having me.
All right, Heather. Bye.
All right, bye-bye.